Hello everyone, Malton Schexnayder here with EraseYourBackPain.com. Over the next few days, what I'm going to do is provide you with some videos in which I will be teaching you some of the strategies I've used to help thousands of people with lower back pain eliminate their back pain quickly. Before we get into the specifics of some of the back pain treatment methods I use, what I'd like to do is help you understand a little bit more about your back pain. To help you do this, what I've done is divide back pain into 4 different diagnostic categories that are responsible for most of the origin of back pain. So regardless if you've been diagnosed with a herniated disc or sciatica or stenosis or any of the other commonly diagnosed problems, the underlying condition can be found in one of these diagnostic patterns. The first diagnostic pattern is forward pelvis syndrome, and incidentally, we're going to talk about each one of these in more detail. So forward pelvis syndrome is the first diagnostic pattern. Secondly, we have backward pelvis syndrome. Thirdly, high pelvis syndrome. And finally, the forward head syndrome. So let's talk about forward pelvis syndrome. Forward pelvis syndrome is characterized by a forward rotation of the pelvis. And what that means is that if you take a look at the neutral pelvis, where the pelvis is basically parallel to the floor, in the forward pelvis syndrome, the front of the pelvis is oriented in a downward position, so the front of the pelvis is lower than the back of the pelvis. In other words, there's a rotation to the pelvis. As a result, we begin to see tightening of the muscles on the front side of the hip and front side of the thigh, and a weakening of the buttocks muscles and the hamstrings. So you'll notice the pattern occurring with each of these syndromes. You'll have tightness of muscles on one side of the body and weakness in muscles that oppose the tight muscles. Following along that same line of thinking, we'll have weakness in the abdominal muscles and an accentuation of the lumbar curve with an associated tightness in the lumbar muscles, creating that imbalance you'll hear me talk over and over again. The backward pelvis syndrome is pretty much just the opposite of the forward pelvis syndrome. So we have a backward orientation of the pelvis, which produces tightness in the buttocks muscles and hamstrings on that side, a weakness of the hip flexors. So once again, we have tightness on one side of the body and weakness on the opposite side of the body, tight abdominals and chest muscles, and a flattening of the lumbar curve. So these muscles on either side of the lumbar spine are going to become weak. All right, in the high pelvis syndrome, we begin to see a high pelvis and shoulder on opposite sides. So if I draw a line across the pelvis here, and then a corresponding line across the shoulders, in this particular case, we'll see a high pelvis on the right side and high shoulder on the left side. And as a result of that, we're going to have tightness in the hip flexors, weakness in the hip extensors, so the buttocks muscles and hamstrings will become weak, tight adductor muscles, and the adductor muscles are the muscles on the inner part of the thigh. And finally, we'll see a little curvature of the spine reminiscent of a scoliosis, but it's actually due to the muscle imbalances that have developed as a result of the change in the position of the pelvis. It's basically a compensatory curve. And then finally, we have the forward head syndrome. The forward head syndrome is characterized by a forward position of the head in relation to the spine. So if you were to drop a plumb line through the center of the body, the head should be positioned where the plumb line is essentially at the level of the ear. But in the forward head syndrome, the head is well forward of the plumb line, and as a result, we begin to see several things happen. First, we begin to see tightness develop in the muscles of the chest and front of the shoulders, causing the shoulders to rotate forward. As a result, the rotator cuff becomes weak, and the rotator cuff is the group of 4 muscles that surround the shoulder and provide the main function of the shoulder. Then there's weakness of the rear shoulder muscles, where obviously we have the front shoulder muscles becoming tight and the rear shoulder muscles becoming weak. And then finally we have weakness of the shoulder stabilizers, which are the muscles between the shoulder blades. So once again, tightness on one side, in this case the chest, and weakness on the opposite side, in this case the shoulder stabilizers. So in summary, what we've covered today are the 4 diagnostic patterns that are the underlying cause of most back pain. In order to be successful in treating your back pain, what we need to do is to first identify what syndrome or syndromes you're presenting with, and then apply the appropriate method to treat that particular problem. And if this is done in a consistent manner, we can help you eliminate your back pain. I'd like to thank you for joining me on this short video. Tomorrow we'll be discussing a little bit more detail about the forward pelvis syndrome, and I'll actually show you a couple of exercises you can implement immediately to help you with your back pain. Again, this is Malton Schexnayder with EraseYourBackPain.com. Please visit my website at www.EraseYourBackPain.com, where you'll find a whole slew of information about back pain along with answers to your questions. Thanks again, and I look forward to talking to you tomorrow.